Vectors are living organisms no, that can transmit infectious pathogens between humans or from animals to humans. So a lot of these vectors are insects, particularly blood ingesting insects like your mosquitoes. And increased rainfall no, and even drought can actually increase the amount of standing water. So this standing water creates more breeding sites for our vectors. Kaya that's why during rainy season, we can always observe increasing cases of dengue and even sometimes no, chikungunya, which is also a family of dengue. They're both arboviruses. So yeah, during those season, no, very rampant ang cases natin ng dengue and other mosquito-borne diseases. So these vectors no are actually serving as vehicles of the pathogen of for example no, let's take the let's take dengue. So these mosquitoes or our vectors carry the dengue virus no, from one infected person to another. So they are transmitted to humans by the bite of an infective female mosquito. And here in the Philippines, the species of mosquito that carry dengue are mostly Aedes aegypti. They are our primary vector. But also in some areas, you also see Aedes albopictus, which is our secondary vector. And in order for a dengue transmission to occur, the female Aedes aegypti mosquito must bite an infected human with dengue during their viremia phase. Viremia phase meaning there is a presence of virus of the dengue virus in their blood. So usually that manifests 2 days before the fever. So after ingestion ng dengue, after the bite of the mosquito, the virus replicates inside the mosquito, and then during another uh, biting or ingesting time for the mosquito, it will bite another person and transmit the dengue virus to that person. So that's how vector-borne diseases are being transmitted among humans. So dengue in particular, no, and even chikungunya have flu-like illness. So it will start with fever, but we usually say that it is dengue if it's accompanied by two of any of the following symptoms. So we have severe headache, we have retroorbital pain or the pain behind your eyes, muscle and joint pains, nausea and vomiting. We have swollen glands and rashes in the skin. So if the fever, high-grade fever at 40 degrees Celsius, accompanied by any of the two uh, uh, symptoms, no, we're highly suspicious that that individual has dengue. And one characteristic comparing dengue to chikungunya is that in chikungunya, the muscle and joint pains are more pronounced. So for example, if an individual went to the primary care provider with characteristic of dengue, but then when they tested with dengue, it is negative, and then that individual has extreme muscle and joint pain, so we're highly suspicious of chikungunya. So those are the symptoms, signs and symptoms that we often see in an individual with dengue and chikungunya. Dengue does not have definitive treatment. So unlike other diseases that you can take antiviral or antibiotics to kill the to kill the pathogen, no, dengue does not have yet medicine. So what we do is to provide symptomatic treatment or supportive treatment. So if for fever, we give paracetamol or any antipyretic. For pain, we give analgesic. No? So those are our management for a dengue or chikungunya individual. So if the symptoms persist, no, it's very important that the primary care provider, seek referral to higher level of care or if that individual is in their home and did not yet seek health care, his or her healthcare provider, it's very important to seek consult, especially that is dengue is if not treated or managed properly and promptly, it can be deadly. So we also check for warning signs in individuals which who manifest dengue symptoms. No, so we one of the warning signs is the abdominal pain, also with the persistent vomiting, bleeding of our mucosa like our gums and our nose, restlessness, liver enlargement, and also if that individual went to his healthcare provider, the provider might request for laboratories, and we can see that in the complete blood count there is an increase in the hematocrit or decrease in the platelet count. So those are the things that we uh, do and observe when a patient suspect of dengue and with the persistent symptoms, no, come to to us, the healthcare providers. So for dengue, chikungunya, no, since it's part of our national AIDS-borne viral diseases for prevention and control program, we always underscore our enhanced 4S. So that's search and destroy, secure self-protection, seek early consultation, support fogging and spraying in hotspot areas. So these 4S is a combination of vector-related uh, interventions and health-seeking behaviors. No? So your search and destroy, ensuring that there are no breeding sites in your household, in your and even in your community. Securing self-protection, or like what I mentioned earlier, wearing long sleeve clothes, light colored clothing, using insect repellent, and your insecticide treated screens for the windows. Also very important, no, the seeking early consultation when you have the symptoms of dengue, the fever, nausea, vomiting, headache, and muscle pain and others, and supporting fogging and spraying in hotspot areas so that once there is an established increase of case in for example, in a barangay, it will no longer it will in effect, no, halt the transmission by uh, killing the adult mosquitoes that can potentially transmit dengue to other individuals. So still enhanced 4S, very critical with very critical to implement vector control measures and ensuring that people are informed of the symptoms so they can seek early consultation. I would like to call on everyone to ensure to be informed of what dengue is, what the symptoms of dengue are, and it's already. I'm not sure if you can hear it, but it's already raining outside. So let's be more proactive in ensuring that we don't have breeding site of mosquitoes in our households, and be responsible, to ensure the cleanliness of our community to lessen the transmission of dengue through vectors.